A brain freeze, also scientifically recognized as a sphenopalatine ganglioneuralgia, is a common temporary headache that many people experience after consuming something very cold very quickly, such as ice cream or a cold drink. But why does this peculiar and often startling sensation occur, and what can we do to prevent it? The phenomenon of brain freeze is linked to a rapid change in the temperature at the roof of the mouth, or palate, which triggers a nerve response, causing the swift constriction and then rapid dilation of blood vessels in the brain. It's one of the body's attempts to regulate temperature and prevent hypothermia. When you consume cold substances quickly, the sudden temperature change in the mouth excites the nerves, specifically the sphenopalatine nerve, which is closely associated with the trigeminal nerve, the main nerve responsible for sensation in the face. The signals sent by this nerve can cause the blood vessels to rapidly constrict, leading to a sort of short circuit in the brain's frontal cortex, the area where headaches are perceived. Researchers suggest that the intense pain of a brain freeze is likely a form of a protective reflex. It encourages the individual to slow down or cease the consumption of the cold item, thus aiding in the stabilization of body temperature. The phenomenon is more common than one might think. According to studies, about 30% of people experience brain freezes. The prevalence of this reaction tends to decrease as people age. This could be due to a decreased sensitivity to temperature changes or perhaps learned behavior to avoid rapidly consuming cold items. 1. Consume cold foods and beverages slowly. Savor your ice cream or chilled drink by taking your time. This prevents the rapid temperature change in the palate that leads to a brain freeze. 2. Drink cold beverages through a straw. Positioning the straw towards the back of the mouth away from the palate can help minimize contact with the sensitive areas associated with triggering brain freeze. 3. Warm the palate with your tongue after eating something cold. Pressing your tongue against the roof of your mouth can help regulate the temperature and potentially stave off the onset of a brain freeze. 4. Try to avoid consuming very cold sustenances if you are overheated. The contrast between your internal body temperature and the cold item may increase the risk of inducing a brain freeze. Even with preventive steps, brain freezes may still occur from time to time for those sensitive to temperature changes. The good news is that they are typically short in duration, lasting only several seconds to a minute or two. As for treatment, warming the palate will help to alleviate the symptoms quickly. Simply pressing your thumb or your warm tongue to the roof of your mouth can reduce the symptoms as the body works to normalize the temperature and blood vessel response. Understanding brain freezes not only makes this curious condition less mysterious, but also allows individuals to enjoy their favorite chili treats with a bit more comfort and confidence.